This is a okay. I know that people generally say that there's no stupid question, but I am actually going to ask a stupid question just to show how naive I am in this case. Is the Canada Health is that a law? Like what do you and then do the provinces then have like additional laws that have to then dovetail with the Canada Health Act? Like what do you even call is it a law? I guess I'm not even sure
That's
what it
real. That's
is.
a real. Actually, it's a really good question. It's a very foundational question. So the Canada Health Act is a federal statute, which means that has the federal government has passed this act in Parliament. Um, but of course, as you know, the federal Parliament cannot pass an act that transgresses provincial jurisdiction, and for various historical reasons, um, the Constitution has been interpreted as saying that essentially the provinces have jurisdiction over healthcare. So the federal government cannot, um, according to the Constitution, interfere with areas of provincial jurisdiction. But, and I mean, you can talk to a constitutional scholar and they can fill your ear, and this is kind of interesting as well. But just because they can't legislate in the area of healthcare, they can give money to the provinces on a purely voluntary basis. So it becomes more like a contract. So the first thing to remember is that because the Canada Health Act is a federal statute, it is not binding on the provinces. Okay, that's ultra vires. That's a no-no. But the act can and does allow the federal government to send money to the provinces. And what the Canada Health Act essentially does is outline the terms of the contract, in terms of the agreement whereby the federal government agrees to um, fund the provinces. And of course, the provinces, as I said, rely on this federal funding. And so you can think of it, so it's binding on the federal government, which is important in another aspect that we can talk about later. But it's the Canada Health Act is not binding in a legal sense on the provinces, but it's a quid pro quo. It's a contract, right? You want this money? Okay, here are the hoops that you have to jump through. You don't want to jump through these hoops? Fine. There's nothing we can do. But of course, is it possible that the provinces can actually uh, uh, provide healthcare without this money? Well, it's probably not. Again, it would be a real hardship. They can legally, but politically they can't. They're sort of locked into this politically, right? So the Canada Health Act is, again, merely binding on the feds. And this does raise another related, interesting legal issue, which is that because this act is binding on the federal government can't ignore it, right? And again, we're sort of, brushing away the weeds here as we go down this route. Um, but what exactly is it that the federal government has to do? Well, there's two things here. And if you can't sleep and you you want to bore yourself, read the Canada Health Act. Actually, it's a little bit more interesting than it might actually keep you awake. Um, and so there are these five provisions of the five provisions of the Canada Health Act, accessibility, comprehensiveness, universality, portability, public administration. These are set out. You want the money? Okay, the Canada Health Act said to the provinces, you want our money? Then you have to set up legislation um, enshrining these five principles, which are fairly amorphous principles, but fine. And that's why provinces have slightly different pieces of legislation. They, in their own ways, meet these five provisions. Okay. But here's the thing. Here's what becomes kind of interesting. The legislation, the Canada Health Act, says that the federal, if any of these five provisions are not being supported by the provinces, Ottawa has the discretion to pull its funding, right? It doesn't mandate it. It doesn't say you must. It just says you've got the choice. So Ottawa, if you want to bring out the big guns and pull the funding, you can do that. The interesting thing is that historically it's never done so. It's never done so. It does have the legal ability, but it's never done so. However, those are sections 8 to 12 of the Canada Health Act. And if this gets too boring, you can just cut this out of the podcast before you air it. So there are two other sections of the Canada Health Act, sections 18 and 19, which are often called the EBUC provision. And EBUC stands for extra billing and user charges. And here's where things get a bit more interesting, because section 18 says thou shalt not extra bill. So if a province permits a physician to extra bill, like the situation I was familiar with when I was an undergraduate, the physician bills Ottawa and then says, oh, that'll be another $10. So if a province is found to have allowed this, then the federal government will claw this money back. For every $10 that Dr. Smith charges, Ottawa will claw that money back. So that's extra billing. User charges is if I go to a GP, often called things like tray fees. If I go to a GP and the GP says, well, I could suture your cut, but oh gosh, these things are expensive, so I'm going to charge you for the needle. I'm going to charge you for the cat gut. I'm going to charge you for the Band-Aid, right? That's extra billing. And so basically what section 20 or 21 of the Canada Health Act says is that Ottawa absolutely must penalize a province if the province is found to be doing this. No ifs, ands, or buts. So Ottawa, all the penalties that Ottawa has ever levied on the provinces have been for transgressions of section 18 and 19. But the thing is that for things like the diagnostic service policy, which came in 2018, and the current Canada Health Act Services policy, Ottawa has articulated or has essentially threatened that it will penalize the provinces by utilizing sections 18 and 19. But again, using nurse practitioners providing insured services, that's not extra billing. I don't know how you can call that extra billing, and it's not user charges either. So why the hell is Ottawa using sections 18 and 19, which are mandatory, rather than something like section 19, which says, essentially that people should have access to healthcare because of need rather than ability to pay? Why not levy a penalty under section 9? Well, so the issue here is that Ottawa refuses to use its discretionary capacity, and is really weaponizing the Canada Health Act by using these two small provisions, which are mandatory, even though, in my estimation, they don't really seem to fit well. So it's an interesting phenomenon at the moment. And again, the more you're depending upon these two sections of extra billing and user charge to do all the work that you want the Canada Health Act to do, the less legally coherent it becomes.